Welcome to this explainer. Today, we're going to demystify the absolute critical steps of substance use recovery. We're specifically going to untangle a really dangerous, yet incredibly common, confusion between two words, detox and rehab. Whether you're seeking help for yourself or trying to guide a loved one, understanding the distinct roles of these two stages isn't just helpful. It can literally be the difference between a temporary pause in substance use and a lifelong recovery. Let's get into it.
You know, when someone you care about is struggling with substance use disorder, finding help feels completely overwhelming. You're suddenly hit with this massive barrage of medical jargon, and two of the biggest terms you'll hear thrown around are detox and rehab. A lot of people use them interchangeably as if they're the exact same thing. But let's tackle this pressing question right now. Which one do you actually need? Well, as we're about to see, that's kind of a trick question, because they serve vastly different yet equally vital purposes.
All right, here's our roadmap for this explainer. First, we'll clear up the treatment confusion. Next, we'll break down the physical step of detox, followed by the mental work of rehab. Then, we'll look at the vital zero-gap transition between the two, and finally, wrap up with the path forward.
Section 1. Clearing the treatment confusion. Why words matter.
Section 2. Detox, the physical step. Listen, using these terms interchangeably can actually derail a person's recovery before it even begins. So let's set the record straight. Detox is a medical rescue mission. By definition, detox is purely about allowing the body to safely eliminate substances. Because, think about it, when someone stops using after prolonged exposure, their body literally goes into shock. This phase is meant to clear the physical foundation. It is absolutely necessary, but, and this is a massive but, it is not the actual treatment of the underlying condition. It's just the stabilization phase.
And because it is a rescue mission, it requires intense medical intervention. During this stage, medical professionals are providing round-the-clock care. They're constantly monitoring vital signs and managing potentially dangerous, sometimes even life-threatening withdrawal symptoms. For example, withdrawing from alcohol or benzodiazepines can actually cause fatal seizures. To manage all this, doctors use highly specific medications. We're talking buprenorphine for opioids to ease that excruciating discomfort that often drives people right back to using, or clonidine to handle other agonizing symptoms.
So, how long does this intense physical clearing actually take? Well, typically, detox lasts anywhere from 5 to 14 days. That window really depends on the specific substance, how long the person was using, and their unique medical history. But the major takeaway here, detox is not a quick fix. It is a mandatory bridge. You simply cannot do the deep, meaningful psychological work of recovery if your body is in an active physical crisis.
Okay, moving to Section 3, Rehabilitation, the mental work.
Now here's where things get really interesting, because the focus completely shifts. We are no longer talking about vital signs and physical stabilization. Rehabilitation is where we heal the mind, the broken relationships, and those deep-seated life patterns that contributed to the substance use in the first place. Think of it this way. If detox puts out the immediate fire in the building, rehab is where you figure out exactly how the fire started and rebuild the structure so it never burns down again.
Whether you're in a highly immersive residential program or an intensive outpatient program, rehab is where you do the real heavy lifting. It's a multifaceted approach. You're doing one-on-one therapy, you're in group sessions, you're actually bringing your family into the fold to heal that broken trust. You're processing deep, underlying trauma with licensed pros. And honestly, most importantly, you're developing the coping skills you need to manage real-world triggers.
I absolutely love this quote from our source material because it captures our core philosophy perfectly. It says, detox stops the physical dependence, but rehab changes the thoughts, behaviors, and circumstances that led to substance use in the first place. That just hits the nail on the head. Without detox, withdrawal prevents therapy. But without rehab, detox is just a temporary band-aid, leaving the root cause entirely untreated, which means the likelihood of relapse stays dangerously high.
Section 4. The zero-gap transition, bringing it all together.
Now we need to look at exactly how we connect that physical clearing with the mental rebuilding to ensure lasting success. When we compare their focuses directly, it makes perfect sense. Detox solves the immediate, short-term physical crisis. Rehab, on the other hand, tackles the necessary longer-term behavioral growth. They are two halves of the exact same coin. You can't skip the physical stabilization if substances are still in your system, but you definitely can't stop there and expect the mental growth to just magically happen on its own.
And you know, this contrast extends right down to the professionals helping you. In detox, you're surrounded by nurses, physicians, and medical techs.
people whose primary training is crisis management and pharmacology to keep you physically safe. But once you transition to rehab, the baton is passed to licensed therapists, counselors, and peer specialists who bring incredible lived experience to guide your therapeutic journey.
For recovery to actually stick, these stages have to happen sequentially. Step 1, then Step 2, then Step 3. But here's the catch. The most dangerous part of this entire journey is the space between the steps. If there is a delay, even a small one, between leaving a medical detox facility and entering a therapeutic rehab, that gap is literally an open invitation for relapse. The momentum is lost, and the person is incredibly vulnerable.
That's exactly why facilities utilizing an integrated model are absolute game changers. The source material highlights iRely Recovery in Los Angeles as a prime example of this. They champion what's called a zero-gap transition. That means on the exact day you finish detox, you step immediately into residential treatment. Your medical team seamlessly hands off your medication protocols to your new counseling team. They do daily assessments, get your family involved from day one, and provide dual diagnosis care, so your mental health is treated right alongside the substance use disorder, using consistent, proven therapies across the whole process.
Finally, Section 5, the path forward.
Let's look at what happens to sustain this incredible momentum once that immersive residential work is done. Because, let's be real, the journey doesn't end when rehab does. You're stepping back out into the real world, and that world is full of old stressors. That is why structured aftercare programming is non-negotiable. Continuing outpatient therapy, leaning into peer support groups, managing medications, and keeping the family involved. This is how those newly learned coping skills become everyday reflexes.
Understanding the critical difference and that vital, seamless connection between detox and rehab is an amazing first step. You now know that detox preps the body and rehab heals the mind. But just knowing isn't enough, right? Taking action and securing that zero-gap transition is how you actually succeed. So I'll leave you with this to think about. When you're looking at a treatment plan for yourself or a loved one, are you just planning to put out the immediate fire, or are you truly ready to build a recovery that lasts?